Back pain sufferers, it's time to get your back back.
I've always had problems in this area.
The pain in my neck is a sharp pain. When I sleep, it hurts, When I turn my head around, it hurts.
In my back, all the way in the left hip and down to my knee.
That fear in the back of my head that if I do this movement, is it gonna hurt?
I would call it a sharp pain.
Most of my pain is in my shoulders and in my neck.
If I feel this way now, how am I going to feel 10 years in the future?
Do I have to live with this back pain forever?
For thousands and thousands of people, many with pain just like yours, the answer to that question is a resounding no. Is there any reason for anyone to have to live through the suffering, discomfort, and torment experienced by the people you've just seen talking? Now, listen to what they've got to say.
Has changed my life considerably. Having to deal with continuous pain and being free from it is a marvelous feeling.
I can go up steps, down steps. I'm living my normal life.
I've had neck pain for over 10 years due to a car accident and having to have surgery. Now, since I've started the therapy, I am completely pain-free. For me, that was a miracle.
If you know what it's like to have serious back pain, this kind of relief can almost seem miraculous. Hi, I'm Andy McCavan, and joining me today is Dr. Min Lee. Good to have you here, Dr. Lee.
Thanks, Andy.
Everyone watching would be interested in learning more about this remarkable treatment method, especially from a doctor who has extensive clinical experience with it.
I'm really excited about the opportunity to be here to tell people about the LCD spinal care system. LCD, by the way, stands for Lumbar Cervical Decompression.
Before we go any further, why don't you tell us a little bit more about yourself, Dr. Lee?
Well, Andy, I'm practicing internal medicine, specializing in pain management.
And it's why we're interested in having Dr. Lee talk to you about the LCD spinal care system. As a pain management specialist, he's considered an expert in the field of spinal biomechanics, the study of the structure of the back. And he's always looking for new answers and treatments that can take a patient's back pain away. And he thinks he's found one in the LCD spinal care system. Dr. Lee?
Absolutely correct.
So, before we dig into this fascinating topic, I'd like our viewers to learn some things they may have never known about back pain.
45% of adults on disability are disabled due to back pain, the single biggest reason in the U.S. More than 65 million Americans experience back problems every year. Only the common cold causes more people to miss work. Americans spend at least $50 billion each year on treating back pain. Almost 6.5 million people in the United States will be treated for back pain today.
And now, we're going to show you how you can get your back back with the LCD spinal care system. Right, Dr. Lee?
That's right. It's definitely an alternative that anyone with back pain should investigate. That's my opinion, but based on published data and my own experiences treating my own patient with this type of therapy.
And why is that?
Well, let's look at what else is out there. There's the painkillers, the muscle relaxants, which are drugs. There's physical therapy, there's bed rest, and finally, there's surgery.
People go through all of that only to find out that it didn't work.
That's correct. They end up back where they started, back pain-wise, or even worse. It's called failed back syndrome, and it's a surgeon's and their patient's worst nightmare.
That's amazing. You don't hear about that part of it, do you?
No, not often enough. But now, with the LCD spinal care system, if you've got back pain, you've got a new alternative. And its rate of success is much higher. Approximately 7 out of 10 patients feel relief of their back pain with LCD.
And that's without all the drawbacks of the other treatment options that you just covered a moment ago.
Remember, the discs have no blood supply of their own. So unlike muscles, bones, and internal organs that get a fresh supply of blood, oxygen, and nutrients with each beat of the heart, discs absorb what they need very slowly from outside. If they're compressed by injury or by the effects of age or a sedentary lifestyle, they'll stay compressed, causing problems, and they can't heal themselves. They can't expand. But the computer-monitored pulling action of the LCD spinal care system acts to expand the discs to foster an improved healing response. Less compression equals more blood and nutrients.
I see.
That's why decompression with the LCD spinal care system is such a logical and intuitive treatment method.
That's really amazing.
It is. a whole new approach to back pain that leaves all the problems connected with the traditional treatments behind.
I've always had problems in this area.
The pains in my neck is a sharp pain.
In my back, all the way in the left hip.
Most of my pain is in my shoulders and in my neck.
Chronic back pain. You live with it every day. You don't need to live with it anymore. Listen to what they're saying now.
Now, since I've started the therapy, I am completely pain-free.
Living my normal life.
What advance in spinal care made this dramatic difference possible? It's called the LCD Spinal Care System. Finally, without drugs, without surgery, without difficult exercises, you can get your back back.
This was the greatest experience. I don't know why I didn't do this sooner.
Felt like a new person, like a new back was put in me.
Within 4 treatments, I went back to work, and I haven't missed a day because of it since.
Here's how the LCD Spinal Care System actually works. The LCD Spinal Care System actually allows your spine to stretch in a very precise, controlled, and comfortable way, allowing discs to suck in or retract herniated sections that may be pinching and inflaming the nerves that cause that all too familiar nagging back pain and sciatic hip and leg pain.
Due to its excellent clinical track record, it has become my first choice for many cases.
As soon as I got up from the table, I felt like I could jump up and down.
I am a lot more active again.
The main thought is, why didn't I find this sooner?
I just want to thank whoever designed this machine that made me pain-free. Thank you, and thank you.
Before I had the therapy, I was concerned about how much it would cost. And finally, when I went and did it, it was definitely worth every penny of it. Now everything's changed and I'm completely comfortable. So I would pay it again. I would pay twice as much.
I started this therapy about 2.5 months ago. Within the first 2 months, I was completely pain-free. I just wish I'd known about this before I had my surgery.